Hi everyone. We'll just wait for doctor to join us and for a few more people to hop on the live. Hello, hi everyone. We're just waiting for Dr. Sreeja to join us and for a few more people to join the live. We'll be starting soon. And Hmm, yeah, I think in another 5 to 7 minutes we'll be starting with our session. So, yeah. Hello, hi. We'll be starting in 5 minutes. How's everyone doing after a long weekend? All great. Thank you. Today's session is going to be about 40 to 45 minutes. We'll be covering some important topics relating to fertility, and we have a great expert joining us from Kinder Hospital, Dr. Shrija. She has years of experience and has helped a lot of couples in their fertility journey. So, very excited for today's session. I think it'll be very insightful to all attendees. We also have a free consultation that you can get post the session. Hello, hi everybody. We're just going to be starting in another 2, 3 minutes, so please hang in there. Hello, hi Dr. Shuja. How are you?
Hi.
Hi, how are you doing? How was the
Good. How are
weekend for
you?
you? How was the weekend for you?
It was good. How was it for you?
It was great, great for me as well. Got some nice
This
chores
is
done.
Tanya, right? Yeah.
Yes,
Sorry,
I'm
I didn't
Tanya.
get
Yes, I'm
Sanya.
Tanya. Hi. Yes, Tanya. Hi. Hi, great. So I think we can wait for another 1 or 2 minutes and then get started. We'll just wait for more people to join us. How is Sunday going for you, Dr. Shuja? It's raining on where I am. Is it raining on your side as well?
It was raining in the morning. Now it is okay.
Oh, how lovely. I think that's what I love about Bangalore. It's always raining. Okay, great. I think without any further ado, we should start with our session. I know we have a few people waiting on us already. So, good afternoon
Okay.
to everybody and welcome. I'm Sania Grover,
Good afternoon.
and I'm so happy to introduce to you Dr. Shrija, who will be helping us with this session of if fertility is the right step for you. We're here today to cut through the confusion and bring to you clarity and practical guidance on fertility, when to seek help, what treatments really work, and how to plan your next steps with confidence. This is a safe space, so please feel free to drop in your questions and we will definitely address them at the end of the session. And a quick reminder, please stick with us towards the end of the session because For all the attendees, there will be a link through which you can book a free consultation with Dr. Srija and exclusive benefits worth 30,000 rupees. Okay, let's get started. I would love to introduce again Dr. Sreeja Rani, Senior IVF Consultant at Kinder Hospital, with over 20 years of experience in her line of work, advanced training in fertility care, and a compassionate patient first approach. Dr. Srija has helped hundreds of couples achieve their dream of parenthood. With her guidance, Kinder Fertility has consistently achieved a success rate of over 80%. Dr. Srija, welcome. We're very happy to have you here.
Thank you, Sonia, for the kind introduction.
Okay, great. I think let's step into the part one of our session, which is when to consider fertility treatment. It's, I think, one of the most common questions that couples have, and sometimes many end up waiting longer than they should, thinking, it'll just happen naturally. Could you walk us through when is the right time, say, to maybe speak to a specialist and what factors really matter?
Yeah, of course. So when to meet a doctor for infertility treatment? You know, there are. I do have many people coming to me. Some are on one extreme, some are on the other extreme. So sometimes people do come after 3 months, 4 months of marriage saying we are not able to conceive. What to do? But all I tell them is please wait. If you don't have any issues, if the periods are regular, please wait for at least 1 year. If both couples are young, of course. If the both partners are young, of course. So ideally, if you are less than 35 years, if your periods are regular, you can wait up to 1 year of unprotected regular sex, unprotected regular intercourse, if you're not using any contraceptive, that is, and you're staying together for 1 year. And if you're not able to conceive, you have to meet the doctor to find out why it is not happening even after 1 year. But there are certain situations where you have to meet your doctor earlier than that. If your periods are irregular, or again, if you're over 36 years, 35 plus 36 years, then please don't wait for 1 year. 6 months you can try. And if you're not conceiving 6 months, because what happens is after 35 years, the ovarian reserve reduces. The
Hmm,
number of eggs in the ovaries reduce at a very fast pace.
hmm,
Like unlike how it would have been after 25 years, 35 years, after 34, 35 years, number of eggs in the ovaries start declining. So you don't have a long time to wait. So if you're not conceiving in 6 months and if you're 36 or older, please meet your doctor. Another
okay.
is irregular periods. If periods are irregular, you have to meet your doctor. Don't wait for 1 year. And then if you have any other medical conditions, like if known medical conditions, like if you have a big fibroid in the uterus, or
Hmm,
if you know you have adenomyosis or endometriosis, I'll explain what these are.
hmm,
Adenomyosis is a condition where the lining tissue of the uterus grow into the walls of the uterus, and the
hmm,
walls get thicker.
okay.
You might have heavy menstrual bleeding, and you might have and you do have heavy pain during periods. That
Hmm,
is adenomyosis. If you're known to have adenomyosis, please don't wait for 1 year. Please meet the doctor. And other thing is, if you're suffering from endometriosis, that is endometriosis is the appearance of endometrial tissue, the lining tissue of the uterus uterine cavity happening outside the uterus. That can cause severe pain during periods, and that can be one reason of infertility. So, if
hmm,
you're having endometriosis, if you're known to have endometriosis or adenomyosis, don't wait for 1 year or even 6 months. Please meet your doctor. So, if you
hmm,
have any of these conditions, periods irregular, and if your age is higher, don't
hmm.
wait for it. Meet your doctor directly. Otherwise, I would say young couples married 4 months, 6 months, don't get worried, don't get stressed out. You can wait
Hmm.
for up to 1.
Hmm. Okay. So it means you have to be very careful in understanding where you are at in your journey to becoming a parent and being very careful about, say, if you have any medical issues, pre-existing issues.
Exactly. Exactly.
I think that's great. Thank you. I think it puts a lot of things into perspective, especially for people who might be confused as to where they are in this journey and what they need. I think we'll move on to the next question that I'm sure a lot of people will have is, you know, there's a big barrier around myths that surround fertility treatments, and especially People, I think even I have at certain point thought, oh, IVF must be extremely painful or extremely expensive, or maybe it's just for older women. So how can you help us separate fact from fiction and help us get towards what the truth is?
Well, IVF is one mode of treatment in fertility treatment. And first, the question, Sanya, you asked me, IVF is painful? No, IVF is not painful at all. So I'll
Hmm.
explain about IVF, more about IVF. IVF is not required in all patients taking treatment for infertility. I would say less than 5 to 10% people require IVF, for less than 5 to 10%. And there are other modes of treatment much before IVF, like you can take medicines, and you might have require a hysteroscopy or diagnostic laparoscopy or something like that, and you just require treatment. After that, you may not require IVF. And IVF is something when it's not for older women. No, even young couples may require IVF if there are indications, if there are reasons to take IVF. Even young couples require IVF. And older women also, there are other modes of treatment. If there are real indications, then only we go for IVF in older women also.
Hmm.
IVF basically is stimulating your ovaries. Normally, one egg develops in one ovary in a month,
Hmm.
and that if it gets first fertilized, develop into a baby.
Hmm.
So in IVF, what we do is we need multiple eggs, around 10 to 15 eggs we need. So we give injections for
Hmm.
9 to 10, not 9 to 11 days, we need give injections.
Hmm.
And once the egg become fully mature or big enough, we
Hmm.
aspirate the eggs through a vagina. And believe me, it is not painful. It is done under anesthesia.
Yes. Hmm.
Of course, injections will be there for 10 to 11
Yes.
days. And the procedure, the aspiration of the eggs from through the vagina is totally painless. It is done under
Hmm.
anesthesia.
Hmm.
These eggs are collected, then, and husband's sperm is collected. The eggs are
Hmm.
fused with the sperm, and
Hmm.
then the embryo or the chota baby is formed. And then on another day, the embryo is put inside the uterus, and that is also not painful. It is
Hmm.
not done under anesthesia. It doesn't require anesthesia. It is not a
Hmm.
painful procedure.
Hmm.
It is done under ultrasound guidance,
Hmm.
and it is not a painful procedure at all. So it's not just that older women require IVF. IVF may be indicated at any age. Any age you
Hmm.
might require IVF, and IVF is not for all. It's just 5 to 10% of people asking for infertility treatment,
Okay.
and it is not painful. Believe.
Hmm. Okay, that's I think very reassuring to hear, especially you walked us roughly through the process. I think there's a lot of conversation around IVF with very less clarity. So I think that really again puts things into perspective. Very helpful. Okay, I'm curious about say cost. Uh, I guess sometimes I think when you hear of it, you feel like, oh, it might be very expensive. Is it something that we can afford? Like, what does it involve financially? And how can couples say plan for it without unnecessary stress?
IVF, honestly, IVF is costly. The cost is somewhere between 1.5 to 2.5 lakhs.
Hmm.
But there are certain insurance, not all insurances cover infertility treatment. There are certain insurance companies which cover fertility treatment, which cover IVF also.
Hmm.
And of course, there are EMI options also available with
Hmm.
certain companies. They offer EMI benefits also. So
Hmm.
I would say if you go through all these routes, IVF may not become very expensive.
Hmm. 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 Okay, that makes sense. Thank you. That's very reassuring. I was also curious about success rates of say IVF. So, what are some factors that can help improve success rates, and how has Kinder's approach been, say, to that has finally helped so many couples have successful IVF pregnancies?
IVF all over the world, the success rate is around 60 to 70%.
Hmm.
So there are many factors which affects the success rate. See, if the couple is young, the success rate is much more.
Hmm.
Or if there are some tubal problems or just minor problems, the success rate are much more. But if the woman is as the woman's age increases, the success rates also reduces. And it
Hmm.
also depends on the ovarian reserve, the number of eggs, the sperm quality,
Hmm.
and the DNA fragmentation, we call it in medical
Hmm.
terms, the quality of the DNA in the sperm.
Hmm.
Fragmentation of the DNA, the success rate will be less.
Hmm.
So it all depends on many factors,
Hmm.
especially patient factor and the husband factor.
Hmm.
Young couple with good sperm DNA, with maybe bilateral tubal block or something, the success rates are much more.
Hmm.
So generally, I would say put it as 60 to 70%. It is it's like there is no general. I cannot say yeah you come for IVF and you will get 70%. I cannot say that to every couple.
Hmm.
So
Hmm.
every person will have their own personalized. I can tell them, say you're older, so your success rates are going to be less. It might be 30 to 40% to some couples. I'll have to
Hmm.
say that. But
Hmm.
another couple, I might say your success rates are really good. It might be 60 to 70% or higher. That depends. It cannot be general. But I would say generally around the world, it is around 60%. I would say.
Okay. Okay. I was also curious, does say a person's health and their partner's general overall health impact the quality of say the IVF cycle and that helping them? If say you have a healthier couple in general who lead a healthy lifestyle, will that have a positive impact on on the you know efficacy of the IVF cycle?
Of course, it will have. How it is the general health affects the quality of the egg and the quality of the sperm.
Hmm.
See, in a patient who is obese, who has PCOD, the quality of the egg also will reduce. Once
Hmm.
your general health improves, say you reduce around 8 to 9 kg, and you quit smoking, you quit alcohol, you quit
Hmm.
drugs. So then the sperm quality, the egg quality improves a lot.
Hmm.
And of course, the general lifestyle, regular exercise, but not excessive exercise, regular adequate exercise.
Okay. Okay.
Excessive exercise can have a negative impact. So if
Okay.
your exercise is adequate and you have a healthy lifestyle, say no smoking, no alcohol, and healthy diet, a lot of vegetables,
Hmm.
fruits, and less caffeine in your diet.
Hmm.
So
Hmm.
all this have impact on the egg quality and the sperm quality.
Hmm.
So when you are exposed to say toxic materials like say pesticides or working, sometimes some
Hmm.
people will have to work with pesticides, especially farmers. That can have an impact on sperm quality
Hmm.
or the
Hmm.
equality. So when you are not exposed to all this, and if your environment is good, if your diet is good, if your
Hmm.
lifestyle is good, so your IVF success rate also will improve because your gamete, your egg and sperm quality are good. So you will definitely have a higher success rate.
Okay. Okay. So any couple that's going for IVF, they really need to prioritize their health to
Of course,
ensure that
yes.
IVF works really well for them. Okay. I was also curious, doctor, what is generally the duration of, say, an IVF procedures per cycle? How long does it take? And, what are the steps involved?
Actually, IVF can be either in a single month or it could be cycle could be segmented. So
Okay.
I told you earlier that we have to give injections for multiple egg development. And the
Hmm.
eggs we collect and fuse with the sperm and the embryo we can put it in the same cycle also.
Hmm.
The same cycle where you give injections for 10 to 11 days, same cycle on the 15th day or 16th day, we can put in the embryos. So it will
Hmm.
take hardly 1 month. That is called fresh transfer.
Hmm.
But if there are certain risks, like if she is having hyperstimulated ovaries, that is, if she has, there's a condition called ovarian hyperstimulation syndrome,
Hmm. Hmm.
where being pregnant is a risk. That is, it
Hmm.
can cause abnormal fluid collection in the tummy, abdominal pain, bloating, all that, and risk of clots in the legs. All these conditions can happen.
Hmm.
So when there is a risk like that, we don't put fresh transfer. We wait for 1 month,
Hmm.
probably 1 month, and then we do frozen transfer. We freeze the embryos and we
Hmm.
transfer it in the next month so that there is no risk to the woman. So
Hmm.
that might take still say more around 2.5 months. So the total
Okay.
IVF duration will be 2.5 months. It could be
Okay.
1 month or it could be 1 month, or it could be 2.5 to 3 months,
Okay.
depending on your health condition. If you are healthy enough, we can do a fresh transfer, or sometimes we might need 1.5 to 2 months extra so that we can put the frozen embryo in the uterus. Once the
Hmm.
uterus is ready for the
Hmm.
ready to receive the embryo, we can do that
Hmm.
by giving tablets, medicines. We keep the uterus ready for the implantation and then we transfer the embryo.
Hmm.
So if it
Hmm.
is not running the same cycle, it can be another cycle, another 1.5 months. So I would
Okay.
say 1 to 3 months is the duration.
Okay. And so maybe the duration would increase if there are a lot of other variables and risks involved. Like you mentioned, if there's someone that has, you know, existing issues, you might say freeze the embryo and then,
1 second. Sorry for that.
no, that's what, there's no problem. So, yeah, so the duration might increase if there are other variables involved, but roughly it's about a 1 to 3 month
Yeah,
duration overall.
exactly.
Okay. Okay. Doctor, I'm also curious, is it common for couples to, say, go through multiple cycles before getting pregnant?
Uh, well, sometimes if your egg reserve is less, the number of eggs obtained through one ovum pickup is less, then we might do embryo pooling. We might give you one more cycle for ovum pick injections, one more cycle of injections. That is not in every person. Only in
Hmm.
some patients where the egg reserve is very less, we might have to do embryo pooling. So one
Hmm.
or two cycles may be required.
Hmm.
And some cases where IVF fails, then we'll have to go for another cycle.
Hmm.
So that can happen. So
Okay.
that is when you have that is when you need more time for IVF.
Hmm.
Normally, one IVF cycle is only for 1 to 3 months.
Okay.
If you need to have a second cycle of IVF, or if you need embryo pooling, then the duration becomes longer.
Okay. Okay. And doctor, I'm curious, you mentioned that, there are instances of IVF failing. What
Hmm.
is something, say, a couple can do to avoid chances of the IVF cycle failing on them? Is there something that they can do in their lifestyle or in their habits that can, maybe maximize success rate?
Yes, there are a lot of things which you can do. One is maintaining an ideal body weight, and maintaining an
Okay.
ideal body weight, not too less, not too much.
Okay.
So, and then avoid excessive exertion, avoid excessive exercise, moderate
Hmm.
exercise, which is good for you. And then healthy
Hmm.
diet, lot of fruits and vegetables, avoid too much of oil, too much of sugar, and too much of refined sugars.
Hmm.
uh, and then avoid smoking, alcohol,
Hmm.
and drugs. All these factors you can do just to improve your gamete quality, and this will improve. And if you have any medical condition like hypertension or diabetes,
Hmm.
control the condition before you go for the IVF treatment.
Okay.
So this will
Okay.
improve the IVF success rates
Okay.
definitely.
Okay. I'm also curious, doctor, if there are, say, any tests or checkups that, they can do before they start with the IVF cycle to know what their situation is and how they're doing.
Yes, yes. We do test for other medical problems like high blood pressure, sugars, thyroid problems, uh, hypertension, all this, and
Hmm.
any vitamin deficiency. All this we
Hmm.
do before going for IVF, because we have to rule out whether she can conceive without IVF. Is there any
Hmm.
medical condition that can be treated which will make her conceive? Then
Hmm.
go for IVF. So we properly rule out other medical conditions.
Hmm.
Any
Okay.
coexisting medical condition we rule out before we take the patient, or direct the patient towards IVF. So there are a lot
Okay.
of tests which is done.
Hmm. Okay. Okay. Also, since we've talked about success rates and tests to be done before, say, the IVF cycle, I'm also curious, what are some factors that led to, say, a failure of an IVF cycle? What are some factors that, can impact the process?
One is the genetics. If there is some chromosomal problem in the embryo,
Hmm.
so the chances, that is we call normal chromosomes, the normal number of chromosomes without any genetic problem, we call it euploid embryo.
Hmm.
Euploid embryo. So the chances of getting a euploid embryo or a normal embryo is much more when you are younger.
Okay.
But as your age advances, say if you are above 36 or above 40, then the
Hmm.
chances of getting a euploid embryo reduces.
Hmm.
And also, if your partner is a chronic smoker,
Hmm.
then the risk of damage to the sperm or the DNA of the sperm
Hmm.
increases. And even if
Hmm.
you do IVF in such couples, the risk of miscarriage again increases. One
Okay.
is the age, one is the genetic defects, or if the couples are having some genetic defects in their genes, any faulty
Hmm.
genes if they're carrying, that also can
Hmm.
increase the success rate of IVF
Hmm.
and their lifestyle habits, all this.
Hmm. Hmm.
So, their dental health, any other medical condition, the
Hmm.
lifestyle factors, all this affect the success rates of IVF.
Hmm. Okay. Dr. Sreeja, I've heard a lot about AMH hormone level, and we keep hearing about it. I'm. Could you, shed some light on what it is and how it impacts the IVF journey?
Yeah, actually, AMH is the full form is anti-Mullerian hormone. It
Okay.
is actually produced by the ovary, and it is actually a test for finding out the reserve, the egg reserve in your ovaries. If
Hmm.
your AMH is like above 1.5, which means the ovarian reserve, the number of eggs in your ovaries is good enough. The reserve
Hmm.
is good. So, if the AMH is low, say AMH reduces with age because the number of eggs in the ovaries drastically reduce with
Hmm.
age.
Hmm.
The reduction happens because the number of eggs are actually fixed from the
Hmm.
time you are in your mother's womb.
Hmm.
From a time a woman is in the mother's womb, the number of eggs are fixed and it
Hmm.
will not keep increasing.
Hmm.
So that after 34 to 37 years, 34 to 37 years, the destruction process starts and it accelerates with your age. So
Hmm.
if the image is low, which means the number of eggs remaining in your ovaries, the good eggs remaining in your ovaries are lesser.
Hmm. Hmm.
So AMH is low means the chances of conception through IVF also reduces, but
Okay.
that is when you need IVF because you take multiple eggs because the chances of natural conception also reduces when your ovarian reserve is lesser.
Hmm. Hmm.
That is
Makes sense.
when you
Yes.
need IVF. So you take multiple eggs and fertilize it and put it back as embryo.
Hmm.
So if your AMH is reducing, don't wait much.
Okay.
Don't wait for a longer time. Please plan your treatment as early as possible.
Okay.
Maximum natural conception you can try, but I wouldn't suggest waiting for more than 6 months if your AMH is low, like less than point one or less than one. So, and there are other conditions where AMH can be very high in polycystic
Hmm.
ovaries. That is also not good.
Okay.
The polycystic ovaries, that is also not good. And
Okay.
again, the chances of conception are lower in polycystic ovaries. So
Hmm.
if the AMH is above 5, again, the chance of conception is so it should be within normal.
Okay. So the normal range would be between 1 to 5.
I would say 1.5 to 4, I would say.
Okay. Okay. So anything above and below that, it's important for people to not wait and then say prioritize going for an IVF cycle.
Yes, yes.
Okay. Okay. I think that makes a lot of sense. I think my final last question to you would be, what what can we do to plan our next step? Uh, when do people then say need to be ready to take an action? What next for a couple that's wanting to go through parenthood?
See, please don't think everybody needs IVF. You
Hmm.
may not require IVF. As I told you, only 5 to 10% people require
Hmm.
IVF.
Hmm.
So you may not require IVF. Please, if you have waited for 1 year
Hmm.
and if you have not conceived,
Hmm.
please meet your doctor. Or like
Okay.
otherwise, if your periods are irregular or if you have any known disease conditions, don't wait. And if your
Hmm.
AMH is low, please don't wait much. Meet your doctor, plan your treatment.
Okay.
So the
Okay.
first step may not be IVF. First step will be investigating you, doing some blood test, doing a test for your husband. We might require semen analysis for the husband,
Okay.
some blood test for you, a basic
Hmm.
scan for you. All this we just evaluate what is the issue, and
Hmm.
once we find out the issue, we need to correct it. So
Okay.
that is how we try to find out what is wrong, where it
हाँ
is
जी,
wrong.
हाँ जी. Okay. So, is that how the first consultation will look like for people? It'll be, say, an analysis of.
First, we'll take a detailed history. We'll ask a
Hmm,
lot of questions. We'll allow them to talk. If there
hmm,
are any issues they want to tell us, we give enough time for them to talk first. And we'll ask a lot of questions, both to the wife and the husband.
hmm.
Then we need some certain blood tests we'll give you, and sometimes we might examine you. Mostly we have to we'll examine you and we'll do a basic scan.
Okay.
These things we'll do, and after that we'll tell you what requires to be done. Once we get all the reports, mostly we'll have an idea what
Hmm,
is wrong and where it is wrong. So
hmm.
accordingly, we'll plan your treatment depending on the findings.
Anji. Okay. So, say if a couple has been trying naturally for more than a year, then I think it's the right time to go to a specialist.
Of course, that is the right time.
Okay. Okay, great. I think these are the questions that I had, and I think we had a great, very insightful conversation. Thank you so much, Dr. Shrija.
I'm
We're
seeing
now,
some questions here,
yes,
like
ma'am.
one
So
question.
definitely, we just wanted to open up the floor to any questions that the audience has. There are a
Yeah, I
few.
can see one question. I heard that through IVF, the possibility of getting twins is very likely. Is it true?
Hmm,
So, well, it is. It is. The chance of twins are higher. Because
hmm,
then, if you have, see, I told you, we fuse the sperm and the egg in the lab, and then we form the embryo and we transfer the embryo to the mother's womb.
hmm,
So, we can transfer either one or two embryos,
hmm,
depending on the quality of the eggs and depending on the patient's consent, depending
hmm,
on what the patient wishes. So
hmm.
if there are two top quality embryos and if you transfer both, the chances of twins is higher. So we
Okay.
discuss with the patient. We discuss with the patient. There is a chance of twins. Do you want two? And if two, if you transfer two also again, then the chances of pregnancy also increase. But the
Hmm,
chances of twins is also there. So we discuss with the patient. We take their
hmm.
opinion according to their wish and the treatment criteria. We transfer either one or two embryos. So
Okay.
even you put two embryos, there is of course a chance of twins. It is definitely there.
Hmm. Okay, I think sounds like such a blessing to be blessed with twins, through IVF. There's Miss Priyanka Raj is a very interesting question. She says, I'm 31 and her husband is 36, and she has PCOS and endometriosis since 5 years. Does this mean that they will have to take more injections?
Don't worry about injections. If I have to see the endometriosis, how big is the endometriosis, and where is the site of the endometriosis? Does it require surgery? And PCOS, how bad is the PCOS? And if the endometriosis is big, you might require a laparoscopic surgery to remove the endometrioma. And PCOS doesn't mean you need to take injections. You can take pills, tablets to correct the problem issue.
Hmm.
And if it is mild or moderate endometriosis, we can try ovulation induction. I can give you ovulation induction drugs along with intrauterine insemination. That is not
Hmm.
IVF, that is IUI. If it is
Hmm.
mild to moderate endometriosis, we can try that. Only if
Hmm.
it doesn't work or if you require surgery, then we have to think about other modes of treatment.
Hmm. Okay, thank you for their answer. I think Miss Priyanka Raj, you can opt for a free consultation with Dr. Srija post this session. I think the next question we have is from Cherry. They are 41 years old and have a 10-year-old girl, planning for the second since the last few years, and they're conceiving naturally, but two times in a row, the heartbeat did not appear. What should be the line of treatment for them?
See, two miscarriages, one, so probably once your age increases, the chances of miscarriage increases, the chances of forming a euploid embryo also reduce. But there are other factors which can cause repetitive miscarriages. So we have to rule out other factors which would have caused a miscarriage. We'll have to do some blood tests, find out if you have any of these issues. So even after having one child, you can develop all these autoimmune disorders. We call it phospholipid antibody syndrome or APLA, and that we have to rule out. And if you
Hmm.
have to any hypothyroidism, we need to rule out. All these things we rule out, and if it can be treated, we can treat it. If there are any of these conditions, it is not like at the end of the story. We can definitely treat it.
Hmm.
So we have to rule out other conditions and see if you can conceive naturally. If natural conception is difficult, only then if your AMH levels are very low, natural conception is difficult, only then we advise IVF. So first
Hmm.
we have to rule out why this miscarriages happened.
Hmm. Okay. Okay. Thank you, Dr. Shrija. I think Mr. Dilip Kumar Agarwal has a very interesting question, which is also something I was curious about. He says, if a 41-year-old female is trying to conceive naturally, what are her chances of getting pregnant?
Of course, there are chances of getting pregnant, but then I mean, there are people who have conceived at 43 and 45 naturally. But the chances may not be as good as you were 25 or 26. The chance of conception naturally will be lesser. The risk of miscarriage is also more. Just because you're 42, we don't advise IVF. Of course, you should try naturally. If you want to conceive when you're 41, please try naturally at least for 6 months, but make sure all other parameters, your hormone levels, just do a preconceptional checkup for you and your husband. Make sure you both are healthy. Try naturally for at least 6 months. And if you don't conceive in 6 months, then think about treatment.
Okay. Okay. There's another question by Mr. Harish. He mentions that the AMH level is 0.21. Is it possible to conceive via IVF?
Yeah, AMH is not the only factor. Along with AMH, we have to check the age of the woman, and also the antral follicle count, the number of eggs seen in day 2 or day 3 of the cycle by scan. That also we need to check. The antral follicle count and the age. These are also other factors. If the antral follicle count is good and if the age is young, she's young, and if AMH is the only factor, then she still has a good chance of conception through IVF. But if AFC is very less, say 0 or 1 or 2, and if the age is say more than 45, the chances are very less. Yes. Depends on other factors also. AMH is not the only factor.
Okay. Could you walk us through what AFC is?
AFC is antral follicle count. So that is another prognostic factor like AMH in IVF. So that also will tell us whether we have to give more doses of injection or less doses of injection in IVF. That also will tell you that tell us about your ovarian reserve. What we do is we do a scan, transvaginal scan usually on the day 2 or day 3 of a woman's cycle. Day 2 or day 3 of the pairs, we do a scan. And this number of small follicles, developing follicles, we count in each ovary. That is called
Hmm.
antral follicle count. That is AFC. If the AFC is very less, then the chances of conception also reduce. So
Hmm.
if we correlate age, AFC, and the AMH, and then we define the prognosis.
Hmm. Okay. Okay. We also have another question coming in. It says we have done two IUI procedures and yet not conceived. The husband is 39 and the wife is 31. Do you have any suggestion for that?
Of course, I will have to investigate thoroughly why
Hmm.
it is not happening, what is the issue, whether there is problem in the ovaries, in the tubes, in the uterus, or the cervix, or whether the husband has an issue. We have to first take a history. We have to take proper history. A lot of questions we'll ask you. Then we'll find out where the problem is, why you have not conceived, and accordingly we'll have to plan the treatment.
Okay. Okay. Another follow-up question from Cherry. What are some genetic tests to rule out genetic factors causing multiple miscarriages? And can IVF help even in the case of genetic chromosomal issues? Their reports are normal and their APLA is normal.
Okay. Genetic disease, any faulty gene, any fault, there are so many genes in our body. So normally there are 46 chromosomes, and any genetic abnormality, any faulty genes, any abnormal genes in the major chromosomes can cause miscarriage. IVF can help in such a way that once we do the form the embryo, we can do an embryo biopsy. That is one thing I want to talk to you about. Our hospital has got NICS. Normally, in olden days, what we used to do is we used to cut the embryo. We used to take some cells from the embryo and send it for biopsy. So that would tell you whether the embryo is normal or not, but that also has the risk of causing injury to the embryo. It's a slight risk of causing
Hmm.
injury to the embryo. Now we have another technology called NICS, that is non-invasive chromosomal screening. What we do is we collect some fluid where the embryo is growing. We collect some fluid around the embryo, which where the embryo is cultured and which contains the DNA of the embryo. That fluid we send it for analysis. That is called a non-invasive chromosomal screening. We'll know the ploidity or the chromosome pattern on the DNA in the embryo without injuring the embryo.
Hmm.
That also we have now. We do NICS. And by doing NICS or embryo biopsy, we will know if the embryo is euploid or not. If the embryo is euploid, we can transfer the embryos, and that will actually alleviate the problem of genetic abnormality.
Hmm. Hmm. Okay. Okay. There's another question coming in from Hari. She says age is 43, account is very less, and size is also not bigger on the 11th day, only 7 millimeters. Is it possible in donor egg to conceive via IVF?
Yes, of course, it is possible. It is definitely possible. Even if age is 43 or even 50, we have had a case of one patient who conceived at 50 but with the donor eggs. It is possible to conceive with donor eggs.
Okay. Okay. Another question. It says we're both less than 30 years and have been trying for more than 3 years now. Wanted to know if lifestyle changes can actually improve the possibility of conceiving.
If you have been trying for 3 years, then I would say we have to, before going in for lifestyle modification, we have to find out if there is something really wrong.
Hmm.
And after 3 years, lifestyle modification alone may not work because 3 years is a long time. So
Okay.
we'll have to investigate if there is anything wrong with any of the partners. We'll have
Hmm.
to do a battery of tests to find out. And if
Hmm.
there is anything, we can correct it.
Okay. Okay, Dr. Shrija, thank you so much. I think another one question from my end is, a lot of youngsters I've seen struggle a lot with fertility. Do you have any advice for younger couples who are just starting out their fertility journey as to how to maybe not have as many obstacles? What are some factors that can make it easier for them? What is your general advice to couples who are trying to become parents?
See, I would say, I don't know whether this will be acceptable in our present social situations, but I would say try to conceive when you are young.
Okay. Hmm.
So, as soon as you get married, don't postpone your pregnancy. I know there are a lot of social issues. They will be studying, they'll be just pursuing the career. It is very difficult to say, please try to conceive. Say, I can't, you're not settled. But then, you're, of course, we have advanced a lot. We have advanced a lot in science, but our bodies are still in the Stone Age. Our bodies
Hmm.
are not advanced. So the
Hmm.
bodies, ovaries get older fast.
Hmm.
So when you're planning, you're getting married at 25 and you're planning your first child at 36,
Hmm.
then you might face problems. So it would have been much easier if you had tried at 25. You would have had, I
Okay.
mean, you would have had a very smooth journey. So
Hmm.
become the journey becomes much tougher when you plan to conceive later. I'm not saying you forget everything, forget your career, and no, it's very difficult. It's very difficult.
Hmm.
But if there is a possibility, if you can try to conceive early,
Hmm.
and that will reduce a lot of issues concerning fertility. And they say if you're planning to have two children, you should have your first child at least by 27. And if you're
Hmm.
planning to have one, it should not, I'm saying first child at 27, you should plan your fertility, your plan your family by 27 at least. If you're
Hmm.
planning to have at least only one child, then plan your fertility journey only at least by 31 years.
Okay.
If you delay it, there are certain, one is risk of miscarriage increases, genetic problems to the babies
Hmm.
increase, then risk of endometriosis, fibroids, all this increase with increasing mother's age.
Hmm.
So all these conditions can happen. It's not at all a very wise
Hmm.
advice to say don't forget your career, plan your family. I know, but
Hmm.
certain things we have to balance our
Hmm.
family and our
Hmm.
career and then take a
Hmm.
decision.
So according to you, people should plan their first child by the age of 30, 31.
At least before 31.
Okay. Plan it before and have it by 30, 31. Okay. Okay, I think we'll take one last question. It's by Pritam. He says that their age is 39 and his wife is also 39. Can they go for IUI?
Uh, that's a very general question. I'll have to find out whether you have tried at least for 1 year and whether there is any other factor causing, if you have not conceived in 1 year, any other factors causing this fertility concern, and if that factor is correctable.
Hmm.
And if it is unexplained infertility, of course, we can go for IUI. But first, we have to find out what is the issue.
Hmm. Okay. Okay. If there are any other questions from the audience, we can take them now. One last question for Dr. Shrija. Okay, I think there is nothing else. Thank you so much, Dr. Shrija, for a very insightful session. I'm sure all of us have, learned a lot about fertility in just, 50 minutes. Thank you so much. We really
Thank you
appreciate
so
your
much.
time.
Thank you so much for the kind words. Thank you.
Thank you. Have a great day. Thank you, audience, for joining us. Before we leave, I would just like to remind you all attendees get a link by which they can book a free consultation with Dr. Shrija. We'll be dropping that link right now in the chat. And thank you so much. If you have any questions, you can always reach out. We'll also drop the number. And yes, thank you for your time.
Thank you. Bye.
Bye bye. We'll just be sharing the link where you can book your. Only admin can send them. Okay, I will just share. We will also be sharing this link at our WhatsApp community. So be rest assured you can find it there. And we'll also be sharing a link to join our WhatsApp community. So if you have any questions or would like to speak to Dr. Shrija, that can be a great platform for you to be connected. Yes, Mr. Dilip, we do have a WhatsApp group. We'll just be sharing the link on chat. Give us a minute. Yes, we've just added the link to the WhatsApp group, so you can join it there. Is the link there? We've also added the link where you can book your free consultation with Dr. Sreeja. I think there is some technical issue. We're unable to share the links, but please don't worry. We'll edit the description of this live, and you can find the links there on Kinder Hospital's YouTube channel. Thank you so much for joining, and thank you for your time.